In this video, I'm going to demonstrate a surgical hand scrub used prior to gowning and gloving and performing surgery. So you'll have to imagine that I'm standing in front of a sink and we have running water. The water is usually activated by an infrared sensor, so you can turn it on and off without having to use your hands, or it has a lever activated by your knee or your foot. There are a few different products. The product we're going to use is a disposable scrub brush with chlorhexidine solution already in the scrub brush. You can also buy plain scrub brushes and then a dispenser of chlorhexidine, and they also come in povidone iodine scrub brushes. You don't want to use the reusable scrub brushes because those bristles are too stiff and they tend to scratch the surface of the skin and actually create more surface bacteria. So I'm going to open this up, and on the inside there is a pick for your nails. And so you'll use the pick to clean the underside of the nails, and so you'll need to spend some time doing that. And rinse off the pick and your fingers as you do this under running water. When you're done with this pick, throw it in the trash receptacle. Don't throw it in the sink because it can go down the drain and clog the drain. As you do this, you want to make sure that your hands do not extend below your waist or above your neck. So keep your hands out like this. This is the safest position. Now I'm going to pick up my scrub brush, and I would get the scrub brush wet under running water, and I'd also get my hands and my arms wet with running water. And then what I'm going to do is, I have a little water here I'm going to squeeze this and create a lot of lather. And this is where you're allowed to make a mess, okay? Because you need to get this lather out, and then you need to coat your hands and your arms. Because the most important part of this scrub, and some would argue the only important part of this scrub, is the contact time of the soap, the antiseptic, on your skin surface. And the scrubbing is just secondary. So make sure your hands and arms are covered in lather. Just like that. Okay. I would also be wearing a surgical mask, but to help with clarity of what I'm saying, I've removed it. So now what I'm going to do is I'm going to scrub each finger and thumb, and I'll divide each digit into 4 separate surfaces, and I'll scrub each surface 4 times. That's the easiest way to remember. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I've divided my thumb into 4 surfaces. Move on to the finger. There are some variations to this technique. This is not the only technique that you will find described. Some variations include doing the fingertips separately, and also going in between, curving your scrub brush and getting in between the fingers. Now I'm going to move to my hand. I'm going to divide my hand into 4 separate surfaces, 10 times on each surface. I'm going to divide my forearm into 2 separate sections. So the section that's distal to my fingers right now, I'll divide that into 4 surfaces. And then up here is the second section, and again, 4 separate surfaces. So at this point, I've scrubbed this hand and arm once. What I'll do with my scrub brush is I'll hold this under running water to rinse away the scrub brush. And now I'll do the same thing on my right hand. I'll work from the fingertips, divide each finger and thumb into 4 separate surfaces, the hand and the forearm. Once I'm done with that, I'm going to rinse this left hand. This is the hand I started with. And when I rinse this hand, I'm going to start with my fingertips. And if my stream of water is right here, I'm going to bring it underwater so all the water runs proximal down to my elbow and drips off. I take care not to touch the faucet with my fingertips. And once that's rinsed, I'll rinse my scrub brush. Okay, so I've just rinsed my left hand. Now I'm going to repeat the whole process by lathering up my hand and my arm. Notice I'm always having my hand above my elbow, so water runs off at my elbow and not towards the tips of my hands. That's so we don't have bacteria coming from my elbow, which is at the border of the area that I'm scrubbing, come down and contaminate my fingertips. So again, I'm creating a lot of lather here. And I'll repeat the scrub, each digit, 4 surfaces, hand, forearm, and then forearm up towards the elbow. When I'm done with that, I'll rinse my scrub brush, and then I'll rinse my right hand. I've just rinsed my right hand, and now I'm going to start the same process on my right hand. I'll get lots of lather, and just using my other hand, I'll spread the lather down towards my elbow. Now, same thing on this hand. Each digit divide into 4 surfaces, and I'll scrub 10 times. When I'm done with this hand and arm, I'll then drop my scrub brush in the sink. I'll come back to this hand and arm, and I'll rinse this hand and arm, and then I'll rinse this hand and arm. So now I'm all rinsed. The whole process should take approximately 5 minutes. And the 5 minutes is important because, again, it's the contact time of the soap to the skin. If you are able to scrub faster than anyone else and get your 10 scrubs done on both hands and arms twice, and you're done at 3 minutes, that's not good enough. The contact time has to be 5 minutes. So take your time. Don't scrub too vigorously as well, because if you scrub too vigorously, you create little abrasions, and that actually increases the amount of surface bacteria on your skin. So now I'm ready to go towards my gown pack and take my towel, dry my hands, and gown and glove.